we don't believe in facts anymore. Maybe it's not that we don't believe in them, maybe it's that we don't trust facts anymore. Or maybe we don't trust the people and the processes and the methods that they use to generate the facts. And that's a pretty troubling state of affairs, because facts are facts, and facts matter. And we have a whole body of scientists who go to work every day trying to learn about our Earth and figure out what's going on and make some predictions. And they've done that, and they've predicted that we face some challenges. And some people believe them, and some people don't. They don't seem to be trusted the way that perhaps we used to trust scientists. Now, I'm not a climate scientist, I'm a doctor. I'm one of those scientists who tries to connect science to particular people's problems. And I had the advantage over climate scientists of doing it for 30 years in a community where I could connect with individuals and they could connect with me. We have more scientific power than we've ever had, and yet I really fear that we're going to blow it on the doctor side because we can't figure out how to connect to the people we take care of, and on the patient side because they don't trust. They don't trust the medicine, they don't trust the doctors. Now, I don't practice anymore. I run something called the American Board of Internal Medicine. If you've heard the expression board-certified doctor, we're the board that certifies 1 in 4 doctors in the United States, so we're a large board. And our doctors are experts. They have knowledge. They have knowledge that can help you. But these days, with ruptured trust, I'm fearful that we won't connect the way we could. What's changed? Why is it so different? Well, first of all, we're all living in a world where we have access to information all the time, always, coming at us every possible way. And we can believe that we can become experts after a little bit of time on the web. This expert lives down the street from me and sells fruits and vegetables, and Dr. Selmore Mango gave him this after 20 minutes on the internet. So it's a pretty powerful way to go. You might have gone to the internet seeking medical information, and what we know about how people process information is they process it through a lens of feeling and emotion, sometimes anxiety. So you might go to a perfectly reputable medical website, and you might decide that wasn't going to work out so well for you. So we need some kind of expertise. We need to connect, we need that trust. Now, measles has been in the headlines a lot lately, over 700 cases in a national epidemic. Why is that news? Let me take you back to the 1950s and 60s. Every year in this country, we had 4 million children who had measles. Not 700, 4 million. 48,000 of them were in the hospital. 4,000 who survived the measles were permanently disabled with neurologic injury. 400 of them died. In 1963, all those scientists got together and created a measles vaccine, and there was a policy to distribute it and make it available to people, and things really changed pretty dramatically. Well, the reason that 700 cases is such a big deal is because in calendar year 2000, we had 0 cases of measles in the United States. 0. 4 million to 0. Those facts matter. But in a world of ruptured trust, we're moving from 0. These are actual children with measles. Those are not just numbers. This picture is from within the last year. This is not the 1950s. And where is this happening? It's happening all over the country in a bunch of different communities. In Minnesota, it's happening in the Somali community. In Brooklyn, it's happening in the Orthodox Jewish community, prompting New York to declare a public health emergency. It's not just insular communities, educated people also are losing trust, what some people describe as Whole Foods moms, losing trust. These are newspaper headlines describing this. It's very broad. It includes mumps too, not just measles. Temple University in Philadelphia has a mumps outbreak, and they're requiring all the students to be vaccinated for mumps. And it isn't just vaccine-preventable diseases, it's also cancer. Entire theories of cancer are out there on the web. If you had a cancer scare and you were looking for what can I find, I'm out there on my own, you might land on this website, which would tell you that you can cure your cancer with purely natural treatment, which you might love to hear, knowing friends who had real serious challenges dealing with traditional cancer therapy. And if you read on, you'll learn that actually cancer is really good for you. It's not bad for you. It makes your body stronger. This website will tell you. The American Society of Clinical Oncology, you might think these are radical fringe views. The American Society of Clinical Oncology surveyed Americans last year and found that 40%, 4 out of 10 Americans believe we can cure cancer with natural therapy alone. That's a scary number, especially if you know that the National Cancer Institute, looking at people who opt for natural treatment alone, know that they are 2.5 times more likely to die from their cancer than if they have traditional therapy. So this lack of trust disconnects us. When people feel they're on their own, they may go out seeking information, and a lot of what's going to challenge them is that information will be statistical. So you might learn about a screening approach to a bad disease that reduces the risk of dying from that disease by 50%. You might find that on the web, and you'd say, that's great, I can reduce my risk 50%, sign me up. I don't care if it's toxic, I don't care if it's expensive, I don't care if it's dangerous, I want to reduce my risk of death by 50%. But what you might not realize is those two people were part of a much larger population of people. And the treatment, the screening approach, was applied to all of them. And most of them didn't actually have much risk. And if you understood the way the statistics might connect to you, you might decide that the impact of that was actually pretty small. And you might not want to go through that, but you might. You would need to work that through in a way that you weren't completely on your own, where somebody could help you figure it out. As a medical student, I had an experience that educated me about this. Yes, that's me as a medical student, goofy mustache and all. I dropped a Venetian blinds on my left wrist and had a deep cut, and it was bleeding. And I said to my then girlfriend, now wife, oh my God, you've got to take me to the emergency room. I'm bleeding. I need stitches. So she did. We got to the emergency room. I met with a surgeon, and he said, actually, it's worse than that. You need more than stitches. You need an open surgical repair because you've injured the nerve. And I'm going to have to get in there and try to connect the two ends of the nerve, because if I don't, you're going to get a neuroma, which will be very painful. And every time your cuff touches your wrist, you will have pain. So you need this operation. Well, I'm a smart medical student, and I say, okay, doctor, what's my risk of getting the neuroma if I have the operation? What's my risk of getting the neuroma if I don't have the operation? And he looked at me and he said, what do you care? What do you mean, what do I care? I'm the patient. I'm the one who's going to go, I care a lot. Well, he says, here's how this works. If you get the neuroma, that was 100% for you. If you didn't get the neuroma, that was 0% for you. You will not have a statistical outcome. You will have the outcome that you have. And I know you, and I know you're a healthy young man who will get through this procedure just fine, and I know I can reduce your risk. You should have that operation. So I did. Here's my scar. Don't have a neuroma. 40 years later, grateful to that man. But connecting the expertise to the individual predicament needs to happen in an environment of trust. So what does the new paradigm look like? Well, the doctor has plenty of expertise, and it's real, those facts. They're real. That knowledge, that expertise is real. But the patient also has plenty of information, plenty of values, plenty of goals, plenty of personal preferences. What we want is a world where the doctor and the patient are coming together where the expertise can be connected to the goals and values and preferences in an environment of trust. Because if we don't have trust, we're not going to get that connection, and people are going to be on their own trying to figure all this out. And it's not just about the expertise. That's not enough either. A friend of mine told me a story that really helped me understand that. She was a new mom. She had a healthy young boy, baby, and one day the baby started vomiting in a way she had not seen the baby vomit before, and she was very concerned. She reached out to the pediatrician's office, and they said, "Oh, don't worry, new moms get nervous, babies vomit, he'll be fine." But she was really worried, and they blew her off, but she said, "No, my baby needs to be seen." And she brought the kid into the office, and the office staff was grumpy, and the pediatrician was behind schedule, but the pediatrician examined the baby and made a diagnosis of a very rare but life-threatening and treatable disease, and referred that baby for treatment, and the baby's life was saved. And you might think that that's the end of the story. But that mom, even though that doctor had saved her baby's life, she left that doctor. Because when you're looking for a doctor, you want to find the expertise, for sure. You want to find an expert doctor. But you want to find an expert doctor who trusts you. Thank you.